So I'm very excited to have all you here today with me. As I go through the talk, we will be taking questions, have an opportunity for discussion and introducing ourselves at the end. But at first, I'm just going to give my message. And today we'll be talking about CHD and RDH needs as human rights. What do we need and how do we get there? As many of you know, Global Arch is a US-based nonprofit, and we're an alliance for rheumatic and congenital heart organizations. Our mission is to improve worldwide lifelong outcomes in childhood onset heart disease through empowering patient and family organizations. Our founding commitment is to empowering the patient-family voice for change. Now, when I say childhood onset heart disease, some of you might not know what I'm talking about. So just to explain, particularly in the US, we talk a lot about congenital heart disease. Congenital heart disease is inborn heart problems. They come from an unknown cause, usually, and they affect all comers. And this is the most common heart problem that affects children in the US and in other high-income countries. But rheumatic heart disease, which is heart damage that is caused by an untreated infection that you get in childhood, is still very common around the world. And it's particularly common in poor countries and in locations of poverty. This was eradicated in the higher income settings, but in many places in the world, this is very common. And in fact, in many places of the world, if you don't have access to children's heart surgery, which 90% of the world's children do not right now, RHD will be more common in children and adults than congenital heart disease. Even though both these disorders start in a different way, rather, in a very different beginning, the stories once we have our diseases are very similar. Both communities need lifelong cardiac care. We have to have access to cardiac surgery, something that 90% of us in the world don't have, access to medications, cardiac testing, and also support and information in terms of managing a messed up heart as a child and young adult. And we find in our community that our journeys are very similar and that we can join together and advocate together. On the left, this is a child with congenital heart disease who is awaiting her surgery. On the right, this is a boy who has rheumatic heart disease and has gotten through his surgery. We really can be in this together. Global Arch was started in 2017 in Barcelona at the first International Congenital Heart Leadership Summit. This was at the World Congress of Pediatric Cardiology held that year. Some of you were there. It was an amazing event. And we brought together leaders from 27 groups. These were patient family leaders from 24 countries. And in addition to founding Global Arch, we decided to create the first ever rights declaration for people living with congenital and rheumatic heart disease. And collectively, we defined the basic principles that are parts of the declaration that you see now. But what does it mean to create a rights declaration? What are you doing when you do that? Well, the dictionary defines a rights declaration as a formal declaration enumerating the rights of the citizen. So by definition, rights declarations are in the context of government. They define how you should be treated by your government and your state. But when you look at when are rights declarations created, they are not created when people have rights. People start standing up and saying, we have a right to this or that to address injustice when they don't have those rights. Making this kind of a statement is a collective statement of self-worth. You're saying, we deserve this, we need this, we're gonna get it. It's aspirational. Nobody ever achieves all the rights that we say everybody should get. Life, liberty, pursuit of happiness, freedom, all those rights are aspirational, and it calls on us to continue to work towards that goal. We don't ever completely achieve it. And rights declarations are a call to action, specifically a call to action by the people involved and also a call to action by the government. And a huge example of this kind of aspirational rights statement comes from the founding constitution of the World Health Organization. So in 1948, 194 countries got together and all agreed that the enjoyment of the highest attainable state of health is one of the fundamental rights of every human being. Right now, we still have 194 countries. So I'm pretty sure that everyone's country who's on this call has stated this in public, everyone's government. But of course, the problem is globally around the world, we don't have CHD and RHD on government agendas. It's not going to be news to anybody on this call that in general, although this is stated for the general population, congenital heart disease and rheumatic heart disease are really not well incorporated in government actions to address health. And this is true not just in poorer settings that are developing healthcare systems, it's very true in rich countries as well. So we don't have the policies, laws, regulations, standards, and funding we need to achieve that promised optimal state of health. And that's a primary goal of the declaration, is to achieve that government engagement in our rights. So we took these principles that were articulated in Barcelona and we expanded it into what I hope you all have read. You can do it when you get off the phone, which is the Declaration of the Rights for Individuals Affected by Childhood Onset Heart Disease, which is a formal declaration. It is written in the language that these declarations are. I'm just going to lead us through the high-level points. It's a page and a half long, so I won't read it all to you, and here's where you can read it. So like all good declaration, it starts with a preamble and a statement of our aspirations. So it reiterates the highest sustainable standard of health is a right of every human being. And we, the undersigned organizations, so this is a collective document. It is not Global Arch's document. We wrote it, but it is only as powerful as all the voices on it. So we, the undersigned organizations, believe that every person affected by childhood onset heart disease has the right to receive services to reach their full potential. And this right is shared by everybody, regardless of age, gender, ethnicity, race, nationality, religion, or socioeconomic status. So that's the aspiration. The first principle is healthcare related. So every person should receive the healthcare they need that is timely, affordable, accessible, safe, patient-centered, and lifelong. We point out that these rights are not just promised in many declarations such as the WHO founding, but specifically in the Convention on the Rights of the Child, which everybody has agreed globally that children should be protected from premature mortality and infant mortality. And then we enumerate specifically that the care can't just be there, it needs to be high quality. And that also part of our healthcare is that patients and families have a right to health education and have a right to involvement in our own care. And next we specify needed government action. So it tries to say very specifically in policy speak, what is it that the governments need to do to achieve this? So first, it makes very clear that it is the government's job to ensure this. This is what governments need to do. And in order to do that, first they need to set standards of care. So set metrics that say, this is our highest possible standard of care, this is what we should reach. It has to put in place accountability. So those standards have to mean something and there has to be a way to measure if they're meeting them. And the way to do that, of course, is to collect data. So you have the government's job is to measure, it's the good of its citizen and to set those standards. And then part of what they should be doing with that data is creating the new laws, policies, and programs which are needed to improve our health. In addition, the data they have needs to be transparent. So as a patient or a family member, we should have access to meaningful data to inform our healthcare decisions. So in the US right now, There's a lot of work going on to make sure that families have information about the surgical outcomes when they're comparing two different surgical centers to decide where to have surgery. And finally, the government needs to focus on equity. They need to ensure that marginalized populations get highest quality of care. In the US right now, African American children have a 30% higher mortality from congenital heart surgery than white children. So this is an issue globally. The next principle we specify is those broader picture of our life. This is not just about our health. So each of us has a right to a life free of discrimination and have access to education, employment, and social benefits and services so that we have full participation and lifelong well-being. Again, we point out that these are rights actually we've already been promised in the Convention of Rights on People with Disabilities, that we are included in there. Our CHD or RHD counts in that document. We specify this needs active protection from stigma, which is a big problem in many places. We need training, accommodation, access to disability and family leave benefits. I know in many countries like the US, although we have disability benefits, it's very hard for congenital heart patients to qualify because it wasn't designed for us. And importantly, social support and mental health services, that we need help managing the stresses and challenges that come with our conditions. So what government actions? It specifies government needs to pass laws to protect those rights and protect from stigma, such as medical privacy, such as employment protections. But specifically, congenital heart disease and rheumatic heart disease need to be included in all the existing programs. And there's many in most countries that address disability, chronic disease, birth defects, all of those programs and policies are out there, but it is very typical that they weren't designed with our communities in mind and they're not being used for that. Again, the government needs to measure the impact, not just health impact, but really get data that says how are our conditions affecting our economic, social, and mental well-beings. And it's the job of government, in the same way the government educates about HIV/AIDS and cancer, that they should be educating the public on congenital and rheumatic heart disease and fighting the stigma we face, fighting that misunderstanding. And finally, we call on not just government, but civil society and professional organizations to promote patient and family organizations. We know that our organizations make a huge difference, and that's essential to patient and family well-being and the promotion of change. So that's a summary of the declaration. But what are our next steps? Well, obviously, this is not a magic wand. I wish we could just say all this and we'd wave our wand and it would be available. But that's not the way it works. So now it's all of our job here, we hope, and Global Arches, to use this declaration, to use it as a tool to bring together the global CHD and RHD community, to raise awareness of our unmet needs, to promote rights-based CHD and RHD advocacy. And obviously, we're not doing this for just so that people know about it. It's not just about awareness. The end goal is needed change, needed policy change, new services, new programs, new funding, and that will lead to better outcomes. So it starts, we, the undersigned organizations. Like any declaration, one of the core ways to be engaged and a heart of the campaign is endorsements. So it demonstrates the strength of our support. When we take this to government, when we talk to media, professional organizations, we need to show the strength of the support for this. How many organizations and people worldwide support this? It's not just the number, it's who are they? Are they respected organizations? We want patient family organizations, but we also want professional and humanitarian organizations. And importantly, there needs to be global representation. So all voices all around the world need to be evident when you look at who's endorsing this declaration. Our goal right now is to get 100 patient family organizations and 50 humanitarian and professional organizational endorsements by December 31st. and 1,000 individuals. We're hoping you can help us achieve that. We need to get the word out. So Global Arch is going to be doing social media campaign, online events like this one. We're going to be talking at conferences and professional meetings. In fact, I will say that we released the declaration in January, and we had a full schedule this spring and summer and into the fall of places where Global Arch was going to be having regional network meetings, speaking at conferences and professional meetings. Of course, that all got canceled. So we're transitioning that all online now. We will be working to get articles about this out in the professional journals, blogs, and as I said, executing those direct meetings with lawmakers and policymakers, particularly in our role as a global voice, focusing around the World Health Organization. Global Arch was at 2 UN General Assemblies in 2017 and 2018. Previously, our plan was to be at the World Health Assembly. It was canceled, but we will continue to get this document there and get our members there as they occur. Who's the audience for this? Well, patient family organizations, humanitarian organizations, professional societies, medical organizations, hospitals can endorse, individuals and government being our target audience in terms of change. So what can you all do on the phone? Well, as I said to start out, Global Arch is an alliance, and our goal is not that we run things, but that we initiate it, we give tools, we send out those messages, and you all can help amplify that collective voice. So we started in January doing some initial images and campaigning. COVID completely obviously shifted our focus. We've been doing a lot of COVID related things recently, but now we're going to be getting back to that active campaigning about CHD and RHD rights, and we hope you will participate. We also are moving forward with creating our Global Arch regional networks, where we're really trying to recruit more members and also bring those members together regionally. Right now, we're working most actively in India, in Africa, and in Europe, but we're hoping we can start doing this globally. And the reason that that's important around the rights advocacy activities is because every region in the world, we understand, has really different needs. So the rights that somebody needs in Uganda and that are going to be most important to focus on for those advocacy efforts are likely to be very different than what the Norwegian and the European groups want to focus on. Again, part of those activities, we're hoping to be the conveners, to be the schedulers, if you will, to put together some of these online and hopefully someday in-person government meetings. And we will be producing materials. So I will say, we don't have the materials we want yet. They are in development, but we know we need lots of supportive documentation for this, that we need to translate it from declaration speak to human speak. We need infographics, we need to get the data out, and we're working with our partners to do this, most notably Children's Heartlink, which has been our ongoing partner in advocacy activities. The other thing we're hoping is that patient family organizations may be able to use this as a tool just for their own activities that they're planning already. So it might be a way to educate your members on their rights, is looking at this document and sort of thinking about it as the idea even that they have rights, that part of their human rights is to have health. And to use it in your existing campaigns and activities. So I know all of you do external education, awareness, and many of you meet with government. I was very pleased that when we had a draft of the declaration, I shared it with one of the US group leaders. And the first thing she said is, oh, we're going to Capitol Hill. Can we take it? Can I have permission to take this? So we're hoping that this can help buttress up those efforts in your region you're already doing. So a tool, if you will, to help us all think broadly, what is the framework of our rights, identify those unmet needs, set priorities, and define action. Now, for humanitarian and professional organizations who have different membership and different roles, we still want you, we still need you, we want you to endorse, and we want you to join in those Global Arch-led activities. We also are hoping that you can include messaging about the declaration and about this idea of childhood onset heart disease patients human rights, health is a right, in your existing activities in education, whether that's professional conferences, journals, things like that. You can help us make that happen. We know we need you to partner with patient family organizations. My experience in the US is that the winning combination to go to government is the provider accompanied by that patient and family voice. And when you look at a more global setting where there's more humanitarian activity needed, that's going to be a threesome. The patient family organizations, the providers, and the humanitarian groups have to be a united voice calling for action on the part of governments. And also, this could be an opportunity to educate your members, whether they're surgeons or the people who are on your missions, whatever it is, about a broader view of patient needs. So I know that, for example, many of the groups that focus on surgery or ICU care may not think so much about the ways that stigma or employment discrimination or not having lifelong access to care really compromises our right to health. So that's just a brief overview of what we're hoping will happen and the ways you can help. We know that everybody on this call shares the Global Arch vision. So all of us agree that every person with childhood onset heart disease deserves and should live a long and full life. Our life should not be limited by our disease. We're hoping that this declaration and this campaign offers a new opportunity for us to come together and start talking about this in a different way and reach different audiences. And in the end, achieve this vision of health for all. Thank you.